Wyoming free CNA practice test with answers 180 questions exam prep. Question 1. Most of our calories should come from Option A, protein. Option B, carbohydrates. Option C, fats. Option D, vitamins. The correct answer is option B, carbohydrates. Carbohydrates. A balanced diet is essential for health. When the client consumes nutrients and the right combination of calories, the person's desired weight is maintained. Carbs supply fuel for the body, so 45 to 65% of calories should come from carbs. The energy is stored in the muscles and liver for immediate or future use, as well as for the brain to function. Question 2. Mrs. Sparks is an 83-year-old female patient who suffers from the late effects of the CVA. She has L-sided hemiplegia. Option A. Vis isa. Paralysis on the left side of the body. Option B. An L-arm contracture. Option C. L-arm and leg itching. Option D. A rash on the L-arm. The correct answer is option A. Vis isa. Paralysis on the left side of the body. Paralysis on the left side of the body. A client with left-sided hemiplegia has paralysis on the left side of the body. The paralysis can be either partial or total. It occurs on the opposite side of the CVA, stroke, or brain disorders. Mrs. Sparks had a CVA on the right side of the brain, resulting in left-sided paralysis. Question 3. A patient appears paler than usual. The nurse aide should. Option A, note it on the chart. Option B, get the patient a snack. Option C. Ask the patient how he feels and take his vital signs immediately. Option D, offer the patient a glass of water. The correct answer is option C. Ask the patient how he feels and take his vital signs immediately. Ask the patient how he feels and take his vital signs immediately. Whenever you notice a change in the client's condition, stop to assess the client and take vital signs. If the client is able to respond, ask the person how they feel. Report the change, vital signs, and client's response to the nurse. When charting, document what you observed and did. Question 4. Which of the following is recommended position for giving an enema? Option A, supine. Option B, prone. Option C, left sims. Option D is semifallers. The correct answer is option C, left sims. Left sims. The left sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. This position is also called the lateral recumbent or semi-prone side position. Question 5. Your resident consumed a bowl of soup that was 180 cubic centimeters of liquid. How many ounces was that? Option A, 7 ounces. Option B, 5 ounces. Option C, 6 ounces. Option D, 4 ounces. The correct answer is option C, 6 ounces. 6 ounces 180 cubic centimeters equals 6 ounces. When converting cubic centimeters, cc, to fluid ounces, oz, remember that 30 cubic centimeters equals 1 ounce. Although an ounce is slightly less, the amounts are considered equal by doctors and pharmacists. Also, 1 cubic centimeter equals 1 ml. Question 6. Mrs. Shumley's nursing care plan lists CHF, congestive heart failure, as her primary diagnosis. Diagnosis. You would expect her ADL routine to include which of the following? Option A, placement of TED hose after ambulation. Option B, a daily jog around the facility for 1 hour. Option C, daily weight measurement. Option D, encouraging oral fluids. The correct answer is option C, daily weight measurement. Daily weight measurement. CHF is a chronic disease that occurs when the heart becomes weak and is no longer able to pump efficiently. It is important to monitor the client's weight. A sudden weight gain means that the client is retaining fluid. This puts a strain on the heart and lungs. The nurse aide should weight the client every morning at the same time and record the weight. Notify the nurse of any sudden changes. Question 7. Which of the following is the safest way to confirm a resident's identity? Option A, check the ID bracelet or tag attached to the resident. Option B, look at the door number and compare it to your room list. Option C, ask the resident's roommate. Option D, call the resident by name and see if the person answers. The correct answer is option A, Check the ID bracelet or tag attached to the resident. Check the ID bracelet or tag attached to the resident. Accurate ID of a resident is always done by checking the resident's ID bracelet or tag. This is a universal standard of practice in every facility and healthcare setting. It ensures that the resident receives the correct treatment and care every time. Question 8. The opening of the colostomy to the outside of the body is called: Option A, the stoma. Option B, the insertion site. Option C, the rectum. Option D, none of the above. The correct answer is option A, the stoma. The stoma. A stoma is an artificial opening in the body, created surgically. To create a colostomy, the surgeon brings the end of the colon through the abdomen and creates a mouth-like opening that will drain waste into a bag. A stoma can also be created for the bladder or the ileum, lowest part of the small intestine. Question 9. Signs and symptoms of shock may include: Option A, increased blood pressure, bradycardia, and flushed skin. Option B, hyperventilation. Option C, absence of respiration and pulse. Option D, low blood pressure, tachycardia, and clammy, pale skin. The correct answer is option D, low blood pressure, tachycardia, and clammy, pale skin. Low blood pressure, tachycardia, and clammy, pale skin. Signs of shock include low blood pressure, rapid heart rate, weak pulse, and pale skin which can be damp or clammy. The client may be breathing rapidly. The client may also be confused or not alert. Shock is an emergent situation. Question 10. Normal urine color is: Option A, colorless. Option B, brown. Option C, or red. Option D, yellow. The correct answer is option D, yellow. Yellow. Normal urine color has a yellow that ranges from dark yellow to light straw color. Urine that is amber colored indicates dehydration. Brown urine can mean severe dehydration or liver disease. Red-tinted urine can occur after clients eat certain foods like beets or blueberries, or can be a sign of kidney disease, urinary tract infection, or prostate problems. Colorless urine may mean that the client is overhydrated. Question 11. To help ensure adequate circulation to prevent patient's skin breakdown, you should: Option A, perform active or passive range of motion exercises. Option B, give back massages. Option C, change the patient's position frequently. Option D, do all of the above. The correct answer is option D, do all of the above. All of the above. One of the primary responsibilities of a nurse aide is to monitor the client's skin for any signs of breakdown. During baths, dressing, or position changes, inspect the skin. Reposition every 2 hours, protecting areas that rub together as well as the bony prominences. Massages of the back and buttocks can promote circulation. ROM are also helpful and report any changes to the nurse. Question 12. Before performing any procedure, a nurse aide must: Option A, identify the patient. Option B, explain the procedure. Option C, wash their hands. Option D, do all of the above. The correct answer is option D, do all of the above. All of the above. Clinical standards require all healthcare professionals to identify the client by checking the ID band or tag before providing care. They should wash their hands both before and after client encounters. They should also explain what they are going to do and give the client an opportunity to ask questions before starting. Question 13. Which of the following statements about blindness are false? Option A, always identify yourself before touching a blind person. Option B, a diabetes is a significant cause of blindness. Option C, most legally blind or visually impaired people have no sight at all. Option D, ask if a blind person needs help before you give assistance. The correct answer is option C, most legally blind or visually impaired people have no sight at all. Most legally blind or visually impaired people have no sight at all. People who are legally blind or visually impaired may still be able to see, but images can be quite blurry even when they're wearing glasses. Only about 10 to 15% of people who are diagnosed as blind see nothing at all. Question 14. Which of the following measurements that you obtain from Mrs. Shumway should be reported immediately to the charge nurse? Option A, a temperature of 99 F. Option B, a respiration 20. Option C, pulse 74. Option D, BP 190/114. The correct answer is option D, BP 190/114. BP 190/114. Hypertension is defined as a blood pressure over 140/90. Severe hypertension is above 180/120. Even if the client has a history of high blood pressure, always immediately report a sudden increase to the nurse. Untreated hypertension can lead to heart disease and stroke. Question 15. On which side should the patient lie for an enema? Option A, whichever side is more comfortable. Option B, the side closer to the restroom. Option C, left. Option D, right. The correct answer is option C, left. Left. The left Sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. It is also called the lateral recumbent or semi-prone side position. Question 16. A resident with an ileostomy evacuates feces through the option A, ileum, option B, colon, option C, jejunum, option D, anus. The correct answer is option A, ileum. Ileum. The ileum is the lowest part of the small intestine. An ileostomy is an opening in the abdomen that is created during surgery. The end of the ileum is placed outside the body and connected to a bag that collects the waste of the intestine. The ileostomy is usually on the lower right side of the body. Question 17. A nurse aide notices blood in the patient's foretubing. The aide should: option A, stop the fore. Option B, notify the fore nurse. Option C, try to flush the tubing. Option D, do nothing, that's normal. The correct answer is option B, notify the fore nurse. Notify the fore nurse. When an fore is running well, the tubing should be clear and the foresight clean and dry. If you notice blood in the tubing, notify the nurse. It is beyond the scope of practice for a nurse aide to do anything within fore. Question 18. Meal trays have arrived. Before serving each tray, the nurse aide should: option A, check each armband, even on familiar patients. Option B, ask about dietary restrictions. Option C, ask patients if they are hungry. Option D, check the temperature of the food. The correct answer is option A, check each armband, even on familiar patients. Check each armband, even on familiar patients. Some clients have special diets, severe food allergies, or strict fluid restrictions. Before serving a meal tray, always check the client's ID band or tag and match it to the correct tray. Question 19. If the nursing care plan, you note that it is written O2 per N/C at 3L, orthopnea POS, as needed. As a CNA, you know that this means which of the following? Option A, orient the new client at 3 o'clock to the orthopedic unit. Option B, the resident is to be ambulated every 3 hours. Option C, oral care must be performed every 3 hours. Option D, the resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. The correct answer is option D. The resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Every facility has a list of approved abbreviations. The CNA should become familiar with these, for reading care plans and for preparing documentation. Question 20. Mrs. Shumway has an order for INO. You have picked up her breakfast and note that she drank half of a 6 ounces glass of juice, 4 ounces of milk, and 8 ounces of coffee. Therefore, you document: option A, 240 ml. Option B, 450 ml. Option C, 685 ml. Option D, 920 ml. The correct answer is option B, 450 ml. 450 ml. Remember 1 ounce equals 30 ml. Add all the ounces intake and multiply by 30. Question 21. Which of the following are associated with smoking? Option A, an ammonia. Option B, a vitamin C deficiency. Option C, heart attacks. Option D, all of the above. The correct answer is option D, all of the above. All of the above. The effects of smoking can cause many diseases and medical complications: lung cancer, COPD, emphysema, pneumonia, heart disease, heart attacks, and strokes. vitamin C and B deficiency. Question 22. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient, option A, had visitors that day, option B, ate too much sugar, option C, had breakfast, option D, has diabetes. The correct answer is option C, had breakfast. Had breakfast. Diabetic clients have a strict schedule regarding insulin injections and eating. Eating causes blood sugar to rise, and the insulin helps move it into the cells. Without food, the blood sugar drops quickly, causing a serious situation. Immediate treatment is necessary. Quickly check the blood sugar level and report it to the nurse. The client will need to eat 15 grams of glucose or a simple carb such as 1/2 cup of orange juice or a tablespoon of sugar. The nurse aide should be aware of which clients are diabetic so that meals are served shortly after the client receive insulin. Question 23. A patient complains that her hand hurts where the 4 is running. The nurse assistant notices that the hand is puffy. The nurse assistant should, option A, reassure the patient that needles always hurt. Option B, put ice on the hand. Option C, notify the medication nurse that the patient is complaining of pain. Option D, notify the 4 nurse that the infusion appears to have infiltrated. The correct answer is option D. Notify the 4 nurse that the infusion appears to have infiltrated. Notify the 4 nurse that the infusion appears to have infiltrated. Infiltrating occurs when the 4 fluid leaks into the tissue because of a dislodged or misplaced 4 catheter. The nurse assistant should monitor the 4 site and report if it becomes swollen, cool to the touch or painful. The skin near the 4 site may look pale. Always be careful when moving or assisting a client with an 4 to avoid pulling the line. Question 24. When caring for a resident with an indwelling Foley catheter, you should, option A, tuck the tubing under the resident's leg to keep it off the floor. Option B, pin the tubing to the resident's gown. Option C, withhold fluids if the bag is too full. Option D, check the bag and tubing frequently for adequate urinary flow. The correct answer is option D. Check the bag and tubing frequently for adequate urinary flow. Check the bag and tubing frequently and for adequate urinary flow. Question 25. You are caring for Mr. Brown, who has a diagnosis of COPD. His SpO2 is 82%. He is currently receiving O2 via nasal cannula at 2 liters/min. What do you do? Option A, turn the O2 to 4 liters/min. Option B, switch the nasal cannula to a mask. Option C, report its stat to the nurse. Option D, ask Mr. Brown to take breaths more frequently. The correct answer is option C, report its stat to the nurse. Report its stat to the nurse. The normal SpO2 range for a client with COPD is 88 to 92%. This is because oxygen reaches the lungs but lung damage prevents oxygen from getting into the blood. For clients with COPD, giving oxygen is carefully regulated with limits according to how the oxygen is delivered. Immediately report a low saturation to the nurse. Do not make any changes on your own. Question 26. Mrs. Hernandez had a hip replacement and is admitted to the long-term care facility for rehabilitation. Her condition is considered option A, a chronic, option B, a tonic, option C, acute, option D, obstetric. The correct answer is option C, acute. Acute. An acute event is a new or sudden situation that is expected to resolve. Examples are a broken bone, head cold or flu, or an asthma attack. Question 27. To take a rectal temperature, a nurse aide should insert the thermometer and option A, stay in the room until it is time to read the temp. Option B, hold on to the thermometer until it can be removed. Option C, take care of other patients, returning in 3 minutes. Option D, go on a break. The correct answer is option B, hold on to the thermometer until it can be removed. Hold on to the thermometer until it can be removed. A rectal reading is the most accurate but needs to be done correctly. After placing the client in Sims position, lubricate the thermometer and insert it about 1 to 2 inches into the rectum. Hold the thermometer in place for 2 minutes to prevent it from being pushed out or advancing into the rectum. Question 28. Drainage bags from urinary catheters should always, option A, be changed every shift. Option B, Be kept below the level of the bladder. Option C. Be fastened securely to the bed frame. Option D. Have their output measured each week. The correct answer is option B. Be kept below the level of the bladder. Be kept below the level of the bladder. Drainage bags from an indwelling Foley catheter should be kept below the level of the bladder to prevent urine from backflowing into the bladder. It also allows gravity to help drain the tubing. Question 29. The charge nurse has asked you to take Mrs. Shumway's vital signs. Before doing so, you must: Option A. Wash your hands. Option B. Gather all appropriate equipment. Option C. Identify the patient and introduce yourself. Option D. All the above. The correct answer is option D. All the above. All the above. Before providing care, the nurse aide must perform all the standard steps in preparation, including gathering everything you need, washing your hands, knocking and introducing yourself, identifying the client and explaining what you will be doing in their care. Question 30. A hospice specializes in the care of people who are: Option A. Chronically ill. Option B. Terminally ill. Option C. On Medicare. Option D. On Medicaid. The correct answer is option B. Terminally ill. Terminally ill. Hospice care is specialized care for clients who are terminally ill. The care includes the family and caregivers. It does not attempt to cure the client but to improve the quality of life for everyone involved. Question 31. When dry, hard stool fills the rectum and will not pass, it is called: Option A. Impaction. Option B. Edema. Option C. Incontinence. Option D. Atrophy. The correct answer is option A. Impaction. Impaction. Fecal impact ions commonly occur in people who suffer with chronic constipation. A fecal impaction is a massive dry, hard stool in the colon or rectum. The client is unable to pass without assistance. Stool may need to be removed manually by inserting a gloved finger into the rectum. Enemas and laxatives may also be tried. Question 32. Strokes are seen in the elderly. A stroke occurs when: Option A. The heart fails. Option B. The brain is deprived of oxygen. Option C. The muscles die. Option D. The lungs fill with fluid. The correct answer is option B. The brain is deprived of oxygen. The brain is deprived of oxygen. A stroke occurs when the blood supply to the brain is cut off, so oxygen cannot reach the brain cells. Strokes are caused by blood clots in the arteries of the brain or a burst blood vessel in the brain. Question 33. Which of the following is a major reason for urinary incontinence in the elderly? Option A. The muscle that keeps the urine in the bladder weakens. Option B. They are too lazy to go to the bathroom. Option C. They can't tell when they need to urinate. Option D. Their circulatory system is failing. The correct answer is option A. The muscle that keeps the urine in the bladder weakens. The muscle that keeps urine in the bladder weakens. As part of the aging process, clients may experience incontinence due to weakness of the muscle that keeps the urine in until the client can go to the toilet. Another reason is that the bladder itself doesn't contract to expel urine. Bladder infections and prostate problems can also contribute. Alzheimer's or multiple sclerosis can also be causes. Question 34. Various factors will change pulse rate. Increased pulse rate can be caused by: Option A. Coma. Option B. Depression. Option C. Sleep. Option D. Exercise. The correct answer is option D. Exercise. Exercise. The heart rate is lowest when the person is at rest or not engaging in physical activity. The heart rate increases when there is a need for more oxygen. Exercise always triggers a faster pulse. Other factors that raise heart rate could be pain, anxiety, stress, or too much thyroid medication. Question 35. Diabetes mellitus makes a resident more prone to develop: Option A. Cancer. Option B. Chills. Option C. Fever. Option D. Infections. The correct answer is option D. Infections. Infections. Diabetics have high blood sugar levels, which can weaken the body's immune system. In diabetes, infections most commonly occur in the urinary tract and skin. Diabetics often have nerve damage. They can develop foot infections without realizing it. Question 36. When lifting a heavy object, which muscle groups should you use? Option A, muscles of the back. Option B, muscles of the hand. Option C, muscles of the shoulder. Option D, muscles of the legs. The correct answer is option D, muscles of the legs. Muscles of the legs. When lifting a client or heavy object, use your legs to position yourself to support the load. Keep your back straight and locked, do not turn or twist. Bend your hips and knees to squat down. Keep the load close to your body and straighten your legs as you lift. Question 37. What can the nurse aide give a resident who has an order for NPO? Option A, unlimited fluids. Option B, small amounts of ice. Option C, only clear liquids. Option D, no food or liquids. The correct answer is option D, no food or liquids. No food or liquids. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order NPO before surgery or certain lab work. If a client is ill or has a gastrointestinal condition, the doctor may write an order to be NPO until the cause is known. The nurse aide can provide mouth care for a client who is NPO.